start in about 30 seconds. Good morning. I'm Mike Friedman, the 113th president of the National Press Club. I am journalist in residence at University of Maryland Global Campus and executive producer of the public broadcasting series, The Kalb Report. The spread of coronavirus is now affecting everything from travel and major events to the stock market, in addition to the human toll. Government, community, faith-based, and corporate organizations across the country and around the world are meeting, monitoring, and urging people to take precautionary measures, including washing your hands frequently, using hand sanitizer, social distancing on site, and staying home if you're not feeling well. We're here this morning to learn more about how our local cities and counties are preparing for possible outbreaks. Do local health officials have enough protective equipment, including masks, respirators, and gloves on hand? Are hospital personnel and first responders trained up to deal with coronavirus patients? Are tests for the virus readily available? What's being done to educate the public in our local communities? To help answer these and other questions, we welcome to the National Press Club George Roberts, Jr., President of the National Association of County and City Health Officials, considered the voice of the nation's nearly 3,000 local health departments. Mr. Roberts has served as the Chief Executive Officer of the Northeast Texas Public Health District since November 2006. Services provided by his home health district include community outreach, disease surveillance, environmental health, immunization, tuberculosis control, and public health emergency preparedness. Mr. Roberts has more than 35 years of healthcare experience, the majority of which was spent in hospital administration. He previously served at the Baylor University Medical Center in Dallas, Mother Frances Hospital in Tyler, Texas, and Henderson Memorial Hospital in Henderson, Texas. He received his Bachelor of Business Administration from Southern Methodist University in Dallas and a master's degree in health administration from the Washington University School of Medicine in St. Louis. Mr. Roberts, the National Press Club podium is yours.
Thank you, sir. Appreciate it. Thank you, Mike. Good morning, everybody. It's a pleasure to be here, and I thank you for the invitation to be here today. I just want to start off first by saying the importance of you as the media. You know, we in local public health, we in public health in general, are counting on you to communicate with the American public about the day-to-day steps that they can take to prepare for the coronavirus. Now, a few words about NACCHO. Mike mentioned it briefly, but just to reiterate, NACCHO, or the National Association of County and City Health Officials, is the voice of local health departments to the 3,000 local health departments across the country. We have the theme that I've shared with NACCHO this year for my year is transformational leadership. And my partner with the Association of State Territory Health Officials is Dr. Nate Smith out of Arkansas. He's the Arkansas Health Commissioner. So mine is transformational leadership, and his is community resiliency. And I think both of those just pair together so well as we deal with this particular situation that we have on our hands that we're facing. Again, my organization, our mission is to prevent illness at Northeast Texas Public Health District, prevent illness, promote health, and protect our communities. A little bit more about my organization. We have programs and services in East Texas in 21 East Texas counties. We serve as the WIC provider in 20 counties in East Texas. We also do public health emergency preparedness in 7 counties in East Texas, along with community outreach, vital statistics, immunizations, TB control, environmental health, And we're fortunate to have many, many great partnerships and working relationships, which include the CDC and in Texas, the Texas Department of State Health Services. Local health departments are to use a phrase, your boots on the ground. We're the ones that are here to interact with the community, and our work is often referred to as invisible. I mean, I'm looking at you in the audience right now. How many of you think about daily your local health departments? The answer is you probably really don't. And so a lot of times our work is invisible while we're out there every day doing such things as making sure you have clean water, have safe food to eat, have vaccinations provided, those things that help you to lead to an active, productive life. As a matter of fact, the back of my business card, I've given a couple of business cards that says, public health, your invisible guardian. And so a lot of times the work that we do is invisible. But, until, when things are going well, our communities and our citizens are working, living their lives and being productive members of society. However, in situations like today, our work is much more visible. All responses to the coronavirus or other reportable diseases are indeed local via surveillance, contact tracing, and potential recommendations to the public for one of three things: either self-monitoring their symptoms, isolating themselves, which means to separate themselves from the public, who have these people, they separate ill people from those who have a communicable from those who are healthy, and then quarantine, which is more of a restrictive type of things to restrict their movement in the community. Now, I want to spend just a minute. I know all of you have heard about coronavirus, but what I've found in situations like that is just sometimes repeating the message repetition is something that we must do at this particular point in time. So let me just kind of go back to the genesis of this whole thing for just a moment. So coronaviruses are a large family of viruses that are common in people and many different species of animals including camels, cattle, cats, and bats. And very rarely, animal coronaviruses can infect people and then spread between people, and such as, we have such things as, the normal coronaviruses that probably all of us have had called the common cold. That's a coronavirus. But then we have more serious situations like MERS. We remember that several years ago, as well as SARS. And this one is now named, the virus here is called SARS-CoV-2. So early on, many of the patients at the epicenter of the outbreak were in Wuhan, the Hubei province of China, had some links to a large seafood and live animal market, suggesting animal-to-person spread. Now, again, back to the coronavirus issue. There's 7 known coronaviruses that can infect people. 4 of those 7 are what we consider I have specific numbers on here, but just basically say that's the common cold. And again, the other ones are MERS, which we found in 2012. That's the Middle Eastern respiratory syndrome. 2012, there was 2,500 cases of that, and 858 people died as a result of MERS. Then we had the SARS back in 2002. There was 8,000 plus cases of that with 775 deaths. And now we have the coronavirus. Up-to-date reporting right now, as of, I checked the CDC website this morning, the CDC said there are 99 cases of coronavirus in our country right now. There's been 10 deaths and 13 states reporting cases. Now, there may be more up-to-date information, but that was the most recent information I had about 2 hours ago when I checked the CDC website, which is what I'm referring to at all times. As of March 4th, the CDC said that they have tested 1,526 cases for patients for coronavirus. So how's this spread? Well, one thing is mainly it's person to person. So if I were to cough right now, I think you're roughly, sir, you're probably 6 feet away from me, so we're probably in good shape. But say for a person that was over here I may cough and I may get respiratory droplets or air droplets on you. That's how it spreads when I either cough or I sneeze or something like that. That's how we spread this. And to a lesser extent, we talked about surfaces. So a lesser extent, you can get it from touching a surface. And I've seen anywhere from, it lives on a surface anyway. I've seen reports that it lives anywhere from a few hours to 9 days. And I don't have the exact science on that, but just know that cleaning of surfaces is probably a good thing to do. So what can we do in situations like this? How do we address this when we have a new novel virus out there? There's no vaccine yet, and there won't be a vaccine for a while. There's no antivirals to deal with this, kind of like we had the flu. We have a flu vaccine, and we have antivirals such as Tamiflu when we get the flu. So how do we handle this? Well, first thing we do is avoid contact with people who are sick. So I'm not sick today. That's good news. Avoid contact with people who are sick. Avoid touching your eyes, your nose, and your mouth. You know, how many of us routinely touch our nose, and that's just kind of, we don't even think about it and we do it, but try to avoid doing that. Stay home when you're sick. You know, that's one of the big things there, and as I tell people sometimes that I may get my man card pulled if I don't stay home when I'm sick. Well, we need to stop that. If you're sick, please stay home. That's one of the best things you do, because you don't want to. It's not basically you're not helping your fellow peers or your coworkers if you don't stay home when you're sick. Cover your cough or sneeze with a tissue, then throw the tissue into the trash or the toilet. Clean and disinfect frequently touched items and surfaces using a regular household cleaning spray or wipe. The next one I've seen, when I was flying yesterday, I saw people with masks. We had at our NACCHO Leadership Week meeting last week, we had a gentleman with the CDC, and I asked him several times to try to get something. I said, so is the regular mask that you wear, does that provide you any protection versus N95? And he goes, the CDC does not recommend that the general public wear a mask. And I asked another way. I said, well, what if I wear the mask down, the N95? The CDC does not recommend that the general public use masks. So the basic recommendation is the CDC does not recommend that people who are well wear a face mask to protect themselves from respiratory diseases. Remember that. If you wear a mask, that's really, it's not doing you any good. Unless you're sick, leave the mask, ladies and gentlemen, for the healthcare providers. When you go to the hospital, that's the time probably to put on a mask. And an N95 mask, how many of y'all on TV, think about it yourself, or I'll look at the audience here and raise your hands. How many of y'all have had a fit test for an N95 mask? Nobody. So if you were to go put one on right now, it may or may not do any good, because you have to have what's called a fit test for that. Healthcare workers are fit tested for an N95 mask. And this is one right here. The biggest thing that I can recommend to you, and probably the most instructive to me over the last week or so as we dealt with that, wash your hands often with soap and water for at least 20 seconds. And I've had to challenge myself to do that. You can sing the happy birthday song a couple times, but I've just resorted to the old simple count to 20. And if you do that, you're washing your hands a whole lot longer than you probably are used to. That, my friends, will make a huge difference. And if you can't use that, use some type of alcohol-based substance to clean your hands. Clean hands, because we as Americans, we like to shake hands with each other. We like to hug each other. Those are the types of things we like to do. Here's an interesting, we did an interesting story in our organization a while back, and it was around National Hand Washing Day. And there was data that came out and I checked it, had my public information auditor check this for me this morning. Data that said and get this one, when people go to the restroom, how many people wash their hands? Well, the data shows that the CDC estimates that only 31% of men and only 65% of women wash their hands after they use the restroom. Ladies and gentlemen, if we can take a step in that, we may help protect ourselves from coronavirus or maybe some other types of diseases that are out there in our population. And we actually did a local story to try to test this out, where my CPIO, who's a male, and one of the TV interns went out. They went to some local restaurants and tested it out to see if these were kind of an unscientific study to see if this was true, and it really was pretty darn true. So please wash your hands, men and women, after you use the restroom. And we'll talk on that when we finish at the end. So what is the incubation period for this time? And this is, and I'm sharing all this with you, number one, for your information for those of you in the audience and those of you at home. But number two, when we go to local gatherings in our community, things like this, these are the types of things that we're repeating. So I think a lot of things that for you and the media can do to help us is repetition of the messaging is so important. But so how deadly is this thing? You know, what is well, right now, Dr. Fauci, I saw a story, he said that the death rate from coronavirus is 3.4%. That was an article I saw in the last couple of days. Now, do we think it's more deadly than that? Do we think it's less deadly? Well, we don't. Still thinking in life, you don't know what the denominator is. And the vast majority, well in excess of 90+% of the cases around the world are in China. We don't know how many cases there really are out there. And why? Because this coronavirus, kind of like the common cold right now, a lot of times we just think maybe we have a headache that morning and we go about our business. A lot of people may have coronavirus or the COVID-19 and not really realize they're sick. So there's probably a lot of testing that went on in China that they didn't really understand. So how deadly is this thing? So just for, so they basically say, and what's the spread rate? So for coronavirus, the COVID-19, so if I have it, if I actually am diagnosed with it, I can infect 2 to 4 people. Now, the seasonal flu is typically a 1-to-1 type of thing. But then you have some more infectious diseases like measles. Measles is roughly 12 to 18 people that are infected. The fatality rate for going back to SARS and Ebola, with the fatality rate was close to 60%. With SARS, it was 10%. And so the message there is that it appears that this 3.4% is higher than seasonal flu rates, but it's also a fatality rates. But again, we don't know what that denominator is yet. So it may be worse, but it may be a whole lot better than we think. Symptoms. Again, pounding the message here. Fever, cough, shortness of breath. How many of you in this audience, and think at home, how many in this audience have ever had fever, cough, and shortness of breath? I'll raise my hand. Do we think we had coronavirus? So from the research that COVID-19, we know that 80% of the cases are mild, with most people not needing hospitalization. However, older adults and people with underlying health conditions like heart disease, lung disease, diabetes are greater risk of complications. And also, let's talk about China for a second. I've never been to China. Maybe some of you in the room have been to China, but it's my understanding that the air quality over there is not as good as ours. So that's one issue potentially they're dealing with. And then I pulled out my phone this morning with Lori Freeman, who's the CEO of NACCHO. We asked our old friend Siri, what's the smoking rate in China? So the U.S. smoking rate, I checked it yesterday, it's like 14% of Americans smoke. 31.8% of the people in China smoke. So therefore, a respiratory illness, they're already higher risk with that in the population of having these issues. So how is this different from the flu? Well, we have similar symptoms and lung complications. It's spread through droplets, but it's caused by different viruses. And just for perspective here, we have worldwide right now, and I didn't see the exact count this morning with the Johns Hopkins website, which I found to be very, very instructive. It's just under 100,000, 90,000 plus. And worldwide deaths, as of yesterday, day before, 3,053. I will say though that look at the recovery rate. Most people are recovering from this. Now let's talk about the flu this year in the United States. Again, go back to the CDC data. The CDC estimates just in the U.S. So I've said around 100,000 worldwide of coronavirus. Just in the United States this year, 32 to 45 million people have had the flu this year in the United States, with 18,000 to 46,000 estimated deaths so far this year from the seasonal flu. And I won't ask for a raise of hands for how many of y'all had a flu shot this year. Very good. I'm very proud of y'all. You're a whole lot better than the average. Thank you for doing that. So we've talked about our background and symptoms. We talked about steps you can do to prevent the spread of coronavirus. Now, how do we address this in our community, which was kind of the primary reason for me coming here today. So, one thing we've been doing, so this whole thing, how many of y'all heard about coronavirus back before Christmas? There's a young lady in the back that heard about it. I think I'd heard briefly about it, but it kind of started to ramp up in January. So we celebrated the New Year's and didn't know a whole lot about corona. We were worried about other things than coronavirus, just 2 months ago. So what have we been doing locally since that time? Well, we've been assessing people who have risk of contracting the disease. We've been finding and testing persons of interest who have been traveled to the impacted countries, which is China, Italy, Iran, South Korea, maybe Japan, or been on cruise ships that have traveled those ports of entry, and who are exhibiting symptoms that we've discussed already, fever, cough, and shortness of breath. We've been working with our local healthcare providers, and I'd say, I'm using this more on a local basis, but I will say this on a national basis with our NACCHO members. NACCHO members are working with their local health care providers to make sure that they know what to look for, answering questions, and in some cases, making sure that they have the CDC test kits to be able to test for the virus. Now, the guidance for testing has really just shifted this week. It's been like in our market, we've had to, if we had a suspect case, we've had to talk with our Department of State Health Services in Texas as well as the CDC to determine if they're going to get the testing. And now it's my understanding that that testing has now gone more into the provider's hands. The provider can, if they believe that this person needs to be tested for coronavirus, that there's some type of travel history or other types of ways that they may have contracted disease, the providers now have that ability to start doing that. Emphasis local media. Again, I'm gonna probably harp on this a lot. We're really counting on you to really get the message about this out to the public. The public is looking to you for information on this. And so we've worked with our local media. We've worked with our radio stations, our television stations, our social media. And we try to put out the information from the CDC, what we've learned. We're trying to come up with new and creative ways to communicate the message to the people where we hope they'll listen and hopefully one thing, wash their hands more. We've inventoried preparedness supplies. In our market, since we're due for public health emergency preparedness in 7 counties, we have a warehouse that has a cache of preparedness supplies. So we've inventoried our N95 masks, and we've encouraged our local healthcare providers to do the same type of work, make sure that they have the personal protective equipment they need. Our public health emergency preparedness team has been meeting with our hospitals, our area schools, government officials to update them and discuss preparations for this. We had a chance to see Dr. Cadillac the other day when he was at our NACCHO meeting before he was going to visit with the vice president. And one of the things he told us, he went through several things, but one of the things he told us is, get prepared. That was his message, get prepared for this. Just this week, in my locality, we had a large meeting on Wednesday with our roughly 75 people of our county government. Several of our cities that are located in our large county, a city which is Tyler, but then several of our smaller city municipalities, their police chiefs, fire chiefs, all came to a meeting. And we talked about this whole situation about coronavirus. We gave them the talking points. We talked to them, and what are you doing to be prepared? How are you going to handle this situation? We also met with emergency management officials to talk about this whole thing as well. Public health departments, I think this is very important. Public health departments spend a lot of time preparing for situations like this. That's why I have a public health emergency preparedness department. And the CDC has, through our state, particularly the state of Texas, has funded us to do preparedness. So what does that cause us to do on a daily basis? We're building those relationships. As they say in life, you don't want to, the first time you meet somebody is in the middle of an emergency. You want to kind of get to know your partners who you're going to be working with, so you establish that ongoing relationship, that ongoing trusted relationship, to where when you have a situation that comes up like coronavirus, or maybe in our market like a tornado, or south of us hurricanes. So we want to be that trusted partner, and I think we are that trusted partner in our community. Now, we also talked to them about the other day about, well, mass gathering. What do you do about if this thing gets large and you have to maybe close your schools or community events? How are you going to make those decisions? Well, the answer in Tyler, Texas may be different than Washington, D.C. or the state of Washington or something like that. Each community is going to have to make those decisions about when do they close a school, when do they cancel an event, et cetera. One of my school superintendents in our area made a comment, said, well, you don't close the schools if you have the flu, do you? Well, no. Well, we close it when we have maybe an absentee rate of, the attendance rate of 84%. That's when we probably make a decision to shut down school for a couple of days, do major cleanings, et cetera. So that'll be up to communities to really have those conversations inside their communities and talk about that and make those decisions. And so we have to balance between, there has to be that fine balance between protecting the community, understanding the risk, and mitigating fear. So protecting the community, understanding the risk of the situation, and mitigating fear. So what can we do today? Well, I've heard this compared to an infectious disease doctor who I have in our area in the state of Texas, who I have a great deal of respect for. Asked him about it the other day. I said, what do you think this is all about? He said, George, I think this may be a bad flu season with no vaccines and no antivirals. So that's probably what we're potentially facing here. So how do we handle that? Good public health measures. And ladies and gentlemen, we've dealt with that. I've been in this job now for over 13 years. I lived through H1N1, and I lived through the Ebola scare. In the Ebola H1N1, I think the first case might have been in Texas. I know the first confirmed case of Ebola in the United States was in Dallas, which is 100 miles from me. And I guarantee you there was a lot of fear about that. But we lived through that. And how did we do that? We didn't have an Ebola vaccine. And we started with H1N1. We didn't have an H1N1 vaccine. So how did we do that? We did that with public health measures that I've just talked about. Washing your hands, covering your cough, staying home when you're sick. Those are the types of things, cleaning surfaces, and just taken some common sense solutions to this whole thing. So I'm going to stop there, ladies and gentlemen. I know you have a lot of questions that I potentially can answer for you. And again, thank you for what you're doing to get this message out. Please share the messages about the symptoms. Please share the messages about what we can do about this whole thing. And together we'll get through this thing.
Thank you. We invite questions from the journalists that are in our audience. If you just want to hold your hand up, Lindsay Underwood will bring the microphone over to you. Let me begin with some questions that have been submitted. How much will getting tested for coronavirus cost you if you're uninsured?
That is a good question. I understand that they're trying to, I know the CDC test does not cost anything. Now, when they become commercially available, Mike, I'm not sure what that is going to actually cost. But, you know, what I would hope for in the future is that, you know, many of us have gone to our physician or our practitioner and been tested for the flu. I would hope in the not too distant future we have some type of test that would give us instantaneous results. I don't know when that will come about. I know the FDA is working on it. I know the commercial manufacturers working on that. But as of right now, I understand the CDC test kits, there is no cost to that.
Okay, thank you. We hear that we may see a dip in the infection rate as the weather warms up and then a spike in the fall. Can you address that?
Well, I wish I could. That's what happened, my memory of H1N1, that's what happened with H1N1. But again, it is a novel new virus. We just don't know the answer to that now. So ask me that question, Mike, in a year, and I probably can answer that for you. But I hope that that's true, but I can't say that. We just don't know the answer to that.
Can people be infected a second time?
I heard, again, Dr. Fauci, I listened to him the other day talking about that, and he doesn't think so at this point. You know, that was one thing with the Spanish flu that people, there was some reinfections and things like that. At this particular point in time, the answer is no, but it could happen. And I think right now, I heard this morning that the cases in China are starting to level out. I don't know if y'all have heard that same thing this morning. I see some head shaking. So that's good news right there.
What percentage of local hospitals' medical supplies are manufactured overseas, some in the very countries most affected by the coronavirus outbreak?
I think that's been one of the real lessons, Mike, and is how much is actually manufactured in China, and so much of our PPE like N95 masks, as well as medicines are manufactured in China. I think there's probably going to be some real changes as we go about in life about that, but I don't know. I think it's a fairly large amount that is actually manufactured over there.
Thank you. Some people are worried about their pets contracting the disease. What are local health officials telling people about that?
That's a question I haven't had yet. I'm sure I will get that at some point in time. I'll look to you. I have not heard any issues with pets right now. Have y'all heard that? Have y'all heard? Have you heard about pets getting? I see your head shaking your head.
There was a case of one dog in Hong Kong. Okay. There was a case of a dog in Hong Kong that tested positive for the virus, but there's no indication whether the dog has no symptoms, but there's no indication whether it is actually sick or whether it can pass the virus to anybody or other animals.
So I haven't heard of anything like that, but that's something that we need to. That's something I need to investigate and be able to know the answer to that.
A question that came in from one of our journalists. Some Asian Americans are reporting increased discrimination stemming from coronavirus fears. How can local governments protect these citizens and their businesses from this type of discrimination?
Well, that's a good question. I think that's going to be probably challenging, but I think over time, as you see, initially it came from China, but now we're seeing it in Italy and some other places. I think over time that's probably going to subside.
How are physician offices being prepared and educated as we move forward?
Sure, that's something that's one of our tasks in our local communities to really talk to doctors, work with. I have physicians on my health district board. I have there's physicians in the community, and it's really continually talking to them. They're the county medical societies, they're hospitals. So it's continually having those conversations, public health, but then the doctors are getting lots of education on their own as well.
Okay, thank you. We have a question.
Yes,
Hi,
ma'am.
I have two questions. One of them hopefully is real quick. The problem that I've heard from different people, and this goes back to the National Governors Conference when the governor of Hawaii was concerned about the test kits, not so much the kits, but the fact that to get the test results done, he had to send them back to the mainland. I mean,
Yeah, to Atlanta, yeah.
yeah, I mean, so my concern is I heard something today that they're looking at possibly having some local commercial labs be able to do these testing so they can get the results quicker. Do you know anything about that?
I can speak to Texas. Yesterday, Governor Abbott announced that there's test kits now in several public health labs in Texas. I know there's a public health lab of East Texas in Tyler, in my municipality, that we hope by the end of the month we'll have the test kits, but they're already out. Test kits are already out in several different locations, public labs in Texas. So yeah, that's been a problem, is having that delay, because right now you have to ship the test directly to the CDC. So it's at least a 72. It has to get there, number one, and then it has to be a 72-hour period after that. So hopefully that will reduce the time. Confirmatory testing, I understand, will still have to go to the CDC, but at least you can have a preliminary diagnosis in a whole lot faster time.
Okay, thank you. And the next question I have, a message went out from APAC saying that there was, they've been aware that a group of policy conference attendees from New York was potentially in contact prior to the conference with an individual who contracted coronavirus. That particular individual didn't attend the conference, but this group supposedly has been added to the self-quarantine list. Now, my concern with that is they haven't given us any more information as to maybe who these people were or where they were or what sessions they attended or anything else. But again, we're looking like second generation. They've been in touch with the person that's got it
Right.
in New York prior to coming to APAC, but they were not the first people to have it. So when you're looking at a situation like that, I mean, they're saying, of course, don't raise the alarm, and everyone's, they just want us to be cautious with it. But again, when you're looking at something like that, this is, there were 18,000 people, I think, is what they said were at that event. So when you have something that could be secondary people, how concerned should we be about that?
I think there's cause for your antenna going up. I think that it's kind of like, but I'd almost compare it to the flu. We probably are exposed to things like that all the time. But in those situations, they would probably, I would think that the local health departments and state health departments might be trying to do some type of contact tracing with the individual to see maybe who might the contacts have been as best they can, maybe the close contacts.
Please go ahead.
Thanks. Andrew Siddons with CQ Roll Call. Secretary Azar this week said that local departments get about half of their funding from the federal government. So one, is that correct? Two, can you just identify some of the main federal funding streams that departments like yours and your members rely on,
So,
and what the trends for those have been?
Sure.
Recent
So, my organization, we have, I'd say probably roughly 70+% of my budget comes from grants. I have my WIC is my largest program, so probably I'd say overall 60% of my overall funding comes from the WIC program. But then I have preparedness funding is a pretty stout amount of my program. I also get funding for chronic disease management, for immunizations. And again, I'm not, as a local health department, there's a few large cities around the country get direct funding from the CDC. My funding comes through the state of Texas. So I get a pretty substantial amount of my funding via CDC. Now, the WIC program is USDA grants. And your other question is about half of the, what was that? I didn't understand your...
What have the trends been in recent years? Has the federal funding been enough for you to do your jobs? And in a situation like this, they just passed the emergency spending bill yesterday. How quickly can you utilize those funds, or do you need more reliable sources of funding year to year?
And I appreciate that question. So so often in life we get it's when things are going. I mentioned public health is your invisible guardian. So a lot of times our work kind of goes. We're working below the. People aren't really seeing what we're doing day in, day out. Obviously now we're a lot more visible. We need types of things. What's been absolutely essential in my organization, this thing has been my epidemiologist, my preparedness staff, my PIO, and my entire team. It's all hands on deck right now. And so we hope to be able to get extra funding to be able to deal with this. And as I understand the bill, 30 days, Lori, that there was something in the bill that said that it was going to be 30 days out, because that's one of the things we were up here last week. We were talking to elected officials about. If we get this funding, let's don't sit around and wait for it for a long period of time. And I think my sense is that they heard that message. It was just a week ago when President Trump asked for the extra funding, and Senator Schumer made his counteroffer, and then he signed it this morning. So we're hopeful of that money, but on a day-to-day basis, we could always use more money. We need that just to be ready to go in situations like this, because the problem is that you don't just bring people in like a news reporter. You just don't bring a new person in that they know everything what to do. You got to have people that are skilled and ready to go with situations like this. Yes, sir.
Yeah,
hi. You're supposed to be.
You're fine.
Yeah, I'm Robert King with Fierce Healthcare. I had a question, kind of piggyback, going back towards the issue with where you get PPE and drugs. Have local health departments and hospitals experienced any shortages of PPE and also any drugs because of the coronavirus? And if so, how do you handle that?
So that's going to be a problem. And I'm answering anecdotally. I understand from the state of Washington that they've really had a lot of the cases that they have really, use the expression, burned through a lot of their PPE dealing with people. And so you have a tendency, when you're dealing with respiratory isolation, you're taking those masks on, you're taking off you're wearing the respiratory isolation material, and you're taking it on and off pretty frequently. So it's a pretty high burn rate. So I'm concerned that we're going to have shortages of that, and I understand. I think part of the funding is to basically help resupply people for that.
Hi, my name's Marisa Fernandez. I'm with Axios. I have two questions. One of them, hopefully quick. Some local counties, or some counties they're asking for local emergency funding, even though they don't have any confirmed cases yet. But there are some cities nearby that might have some confirmed cases. Is that the proper response?
Well, it's all about, because again, what I found in my organization is you may not have a confirmed case, but we've already had several suspect cases. We've had several cases of monitoring, and what it does, it basically you have other diseases. There are other diseases out there that need to be monitored. So you're having to take staff away from a lot of their other jobs. So you do need extra funding just for the situation. Fortunately, in East Texas, we never had an Ebola case. We spent a lot of time preparing for that type of situation.
Thank you. And my next question is, you mentioned in China and some other countries, they've essentially shut down a lot of the cities that are experiencing a lot of spread. Do you see the federal government having a role in that if we ever get to that point? Just because you just said there was a case-by-case basis in terms of cities, and that could cause a lot of economic destruction for some local cities.
I think obviously our system of government here is totally different. I would see that first starting at a local level and moving up to the state and national. But I would see it more of those types of situations starting locally versus nationally, and that's my opinion at this point. But again, I think the response the United States would not be able to do anything remotely similar to what China did, just because the way our system of government is, and thank goodness for our freedoms here.
Your organization, the National Association of County and City Health Officials, represents nearly 3,000 local health departments nationwide. What are some of the questions that you're getting from them now? Are you being inundated with questions, and how are you handling these?
A lot of the questions that you're asking, the PPE question. How do you meet with your city and counties? the relationship with doctors. What's the role of the local health authority? You know, I can speak to Texas on that, but others, what's the medical direction? How much authority does the local health authority have versus the individual physician? There's many questions that have come up. That I think that's what NACCHO is here for, to be that resource for our other locals. And also, I know in Texas we have what's called a state association of county and city health officials, and we have email streams that we can just throw out a question out there to our peers and let our peers answer it. Our SACHO is very important, but NACCHO is also very, very important as well. It's basically what are best practices out there. We were Lori Freeman and I we had a state association meeting this week in Houston, and Houston was dealing with the situation. The Harris County judge came, and they were dealing with the situation of we have no confirmed cases of coronavirus at that point in their community, but do we cancel the Houston Rock Rodeo and Stock Show, which is a major event in that community? And they were saying no, because there's not a reason to do that. But so that every community will. So I think probably issues about closing of things will be probably something that NACCHO will have to deal with as well.
A lot of employees of municipalities are represented by unions. Talk about the relationship between your organization and the unions, and whether there are collaborations already underway to deal with this, since the unions' first responsibility is to protect their own members.
Well, I can just say in our state we do not have a union in our organization, so I can't totally address the union thing, but I will tell you, as the leader of my organization, my job is to make sure that my employees are protected. So that's, you know, my employees are my number one resource. I can't do my job without my employees. So my job is whether or not I have a union or not, I want to make sure my employees are protected.
Okay. We have 3 questions. We'll take all 3 in a row. Go ahead.
Hi,
The
Erin.
lady who had the answers.
Yeah. Hi, I'm Erin Garcia de Jesus with Science News. And I have 2 related questions. So first, what percentage of local health departments actually have kits to do the testing? And then also, LabCorp and Quest Diagnostics will be offering tests. So where should people go for testing? To their health department, or should they call their doctor for testing at one of the commercial labs?
CD, so your first question back to, I don't have any, we basically have to get that from the CDC. So I think we have access to, I'm not sure exactly where in our community I'm getting that from, but we're accessing those. Question, I'm not sure when the commercially available tests will be available, but that would be my always answer to that whole question would be, if you have a concern about your health, contact your physician or your medical provider. And then also, I would also ask that they be contacted. Call them first to let them know your symptoms, so the provider can greet you with the proper protective equipment on, so they don't get infected. Because we don't want, at the end of the day, we don't want our providers to get sick. So we want them providers out there healthy every day, taking care of people. Does that answer that? Okay.
You've touched on this some, but I was wondering whether you could sort of walk us through the factors local officials would consider when deciding whether or not to cancel a large event like a convention or a sports event, like a kind of one-off event like the rodeo. What exactly do you look at?
Sure, I think you'd have to look at, so what is what's the case on the ground? What is, how many cases of, in this case, coronavirus do you actually have in your community? You know, what would that level have to be before you, is it 1 case, is it 10 cases, a lot? And it would be, they would be in concert with our local officials, local leaders. It'd be our government officials, our community leaders, coming together and have a conference about our schools, sitting down and talking about it. What's going to necessitate this, and what is the public saying about it? And sometimes I know in Austin there was a large petition to try to cancel South by Southwest, and Austin said, we've got no confirmed cases in our market right now. It's on. So it would have to be, the answer would be, it would be a conversation amongst elected officials, community leaders to help make that decision. And then I would, want to weigh in on the conversation as well, but there would be a community, the leaders making that call.
And is it fair to say that the tipping point would vary from location to location?
Absolutely.
Okay.
Absolutely. Absolutely.
For Dos Alford with MedTech Insight. I was wondering if there's been any conversations about any public-private partnerships in the past. U.S. government has funded, like the Novartis BARDA plant in North Carolina, that funded vaccine, plants. In this situation, there seems to be a question about whether there's enough diagnostics tests. Would there be any sort of potential where the U.S. government could work with diagnostic manufacturers so that whenever an emergency is triggered, they can mass manufacture diagnostics tests?
I think, and I'm looking at our CEO right now, who has pretty intimate knowledge of the bill itself that was passed. Isn't there some money in the bill to try to get some testing done? Yeah, I believe so. So I think the answer to the question, I believe there's funding inside the bill that President Trump signed this morning to basically do some of that. So I think and I know this administration has been very proactive on things like public-private partnerships. So I believe the answer to your question is yes, but without reading the information totally for myself, but I believe the answer is yes. And you had a second question too, was it? Okay, they got it. Okay.
Hi there.
Hi there.
My name is Rachel, and I'm with Modern Healthcare. And hospitals and nurses had asked Congress for some funding for preparedness and reimbursement for their response costs. But it looks like that funding is going to be filtered through the states and local health agencies. So I was wondering if you could elaborate on kind of what conversations you're having with hospitals and kind of how that money will filter.
Yeah, and I quite frankly have not had that. We've been talking about response and getting information out, et cetera. We haven't had the conversation about the money, at least in my market yet. But my guess is there's some hospitals and public health that have had, and states that have had those same conversations. But I have not had those conversations yet. But thank you for prompting that. I'm sure that conversation is going to happen sooner versus later. Thank you.
Hi, I'm Shannon Firth. I'm with MedPage today. I have two questions. First is the CDC has sort of relaxed, in a sense, its recommendations around healthcare providers and contact tracing and risk assessment in areas where there is community spread. Is that a good idea for healthcare providers to have less?
More, right? You're referring to the test kits, more access to testing?
No, I'm talking about healthcare providers themselves and the protections that they should have in terms of them not getting sick. If they've been exposed to someone with COVID-19, what should people be doing to ensure that they're not then becoming sick and spreading it?
Yeah, that would be part of the answer. Would be make sure they're wearing their respiratory, their proper PPE. I haven't seen the recommendations that you're discussing right now, but
as far as contact tracing,
yeah,
and
contact tracing. Well,
assessment.
contact would be with a physician. I would hope some of the physicians, if they've been exposed, that they're doing their own self-monitoring with checking for fever and cough and that type of thing, monitoring their symptoms.
Okay, my second question is just in terms of testing itself. I spoke with one physician who had seen, so I understand that right now the criteria for testing are that if a physician feels that the person could have COVID-19, then they can test them. If that's
new.
It's up to the physician.
That is my understanding. That is the new, because it was with the cases we've had in our market. You've had had the assessment by the provider, and then a conversation with the with my team as well as the Texas Department of State Health Services, and then the CDC to determine if they're actually going to do the testing. But now it's more provider can make the call. So that's going, and that's why there's been more test kits that have been distributed, particularly in Texas. And I can't really speak to the other states, but Texas, we've seen more test kits get out there. And then I think ultimately it'll be more of you get sick, you go to the physician, and you go back to his question about the commercially available. I think I'm not sure when those test kits, the commercially available test kits, will be out there, but my guess is they'll be sooner versus later.
So are we kind of rationing them in the meantime? Because I spoke to one physician who said that she saw a first responder who had, been around a patient, who had answered a call with someone who may have COVID-19, came to her, had symptoms, and she went to the CDC, asked to test him, and could not test that person.
I think that was up until like last couple of days that's changed. But my guess is that the provider, we're going to be looking more at the provider to make that call. I know we had a couple of our suspect cases. The first case we had in our market, the provider actually once the provider actually evaluated the patient, the provider did not see a need to even go further. The second case was taken on to the CDC, and the CDC and the state made a decision that did not meet the criteria. So I think with what's going to happen with this new criteria, you're going to see more and more testing done. And I think that's kind of what we're going to see here ultimately is, one of the things that, I think we need in public health and providers want is what's our denominator? How many people do we actually have out there? And that's where the contact tracing can get better and better.
Thank
What are the biggest questions that remain in the scientific and medical communities?
Oh gosh, I think your first question, one of the first questions you asked me, with this thing? Does the change of seasons have an impact? How long will it take for this thing to burn out? How quickly can we get a vaccine? How quickly, knowing that the vaccine will take probably a year, how quickly can we get some type of antivirals like it'd be nice to have at least something like a Tamiflu example that we can give to patients like this. What are how much will this actually spread once it gets to the United States? Once we start seeing more spreading in our country. How quickly will it spread? And is it still will it spread? Can I give it to 2 to 4 people, or is it less than that, more like the seasonal flu? So there's many questions. Like again, it's a new virus, so we're all kind of learning something new every day.
Are you getting questions from some communities, cities that are thinking of literally shutting down at this point? And do you see sometime in the near future somebody taking that step and doing
actually
that?
Shutting off a city per se?
Yeah.
Actually quarantine? I've heard I've not heard of any city that's considering that. I've heard a lot of, should I cancel my event? Should I cancel my conference? Should I cancel an event that I'm planning to have? Those are the types of things like that. What should I do about church services? What would constitute shutting down the school for a period of time if 1 or 2 cases come up?
Okay, thank you. We have another question.
Yeah, Joyce Frieden, MedPage Today. One of the things you mentioned was people staying at home if they're sick.
Yes, ma'am. Would you like to repeat that?
One of the things you mentioned was people staying at home if they are sick. One of the questions that's been asked, particularly in the Senate, is about workers who have, service jobs and don't have paid sick leave, and so they don't, they want to stay home, but it's a difference of putting food on the table. Are public health officials talking with local employers about dealing with that situation and trying to encourage that?
That's a good question, and I would hope that local employers would do that and see the need, because again, if the employee it may hurt them if they're not sick, if they're not there to work that day, but if they come to work and get other people sick, then that employer has more to deal with the next day or the day after, something like that. So it's more of a help. It's better off for the employer to be able to offer that paid time off than it would be in this situation than it would the alternative.
We have another question.
Yes, ma'am.
Hi, it's Olivia Zhang with China-based Taixing Media, and I think you mentioned about the smoking rate.
Yes.
I'm wondering, is that already scientific proof that if you smoke, you have more chance to get the virus?
Yes. Well, no. Let me qualify that. So we know smoking is harmful to you for your lungs. You can see the data here in the United States, really going back to the 60s when we started looking at smoking was hazardous to your health. And why was it hazardous to your health? Because we found it may cause lung cancer. And we've seen, over the years, we've seen X-rays of people, their lungs, and basically the damage that cigarette smoking does to your lungs. And so I'm making the correlation with the higher smoking rate in China, perhaps that perhaps the lungs of the people in China aren't as strong as with a higher smoking rate. Smoking is not good for your lungs, and so therefore, and this is a respiratory illness. So that's the correlation I'm making.
Right, but not this specific virus.
No, just respiratory. It's since this is a respiratory illness, it's impacting your lungs. With fever, cough, shortness of breath. So that the smoking does not help you when you potentially get a respiratory disease.
Right. Secondly, as you mentioned, the CDC doesn't recommend healthy people to wear masks, but
correct.
I understand there are some asymptomatic patients, and if you this person have no symptoms, but I'm a healthy person, but he or she doesn't have symptoms. But what if he's infected? And if I'm a healthy person, I'm wearing a mask. Does that minimize the chance of me getting infected from her who doesn't know she's infected?
Potentially, it's probably better for the person. But again, we're wanting to I'm going to kind of go back to the general CDC. When I was asking the same type of questions you, the CDC guy the other day, who basically was saying the CDC does not recommend the general public use masks at this time. And so we want to keep those masks for the healthcare providers or for people when they go into the hospital or situations and actually need that as personal protective equipment. Did that answer your question? Not really. Not really?
Yes, I was saying like because thanks. So because like see, we assume like we're both healthy people, but what if like I'm affected, but I don't know, and I'm not wearing a mask? So like healthy people like you are wearing mask probably help you to, prevent getting virus from me, because I'm not wearing mask because I don't know I'm affected.
Yeah, so you're going to really go back to, if you're infected, should you wear a mask? And I'm going to go back to the CDC.
That's because I don't have symptoms, so I don't know I'm affected.
Okay, well, you don't have symptoms, but again, if you're healthy, again, go back to the whole CDC guidelines. If you're healthy, the CDC does not recommend that you wear a mask. I'm kind of pounding that talking point.
Let me follow up on
Yes, thank
that
you.
then. Do you envision a time when the CDC may change its protocol on that?
I think it's always subject to, we'll have to see how this whole thing goes, would be the answer, Mike. Could be, that would probably be, what's happening at the particular time.
Do we have any other questions from, we do.
Hi, Tim Grübel, German television. In Germany, we have a lot of coronavirus cases, and so we have the problem that the supermarkets are empty. There are a lot of preppers who are buying toilet paper, water. 2 questions. Do you see the same problem in the US, that there are a lot of people who want to buy everything for their homes? And the second question is, are there any planned events to inform the public what they have to do and what they have to buy, for example?
Oh, well, preparedness. We talk in preparedness about, what should you do just for normal routine? What should you be prepared for? Say, for example, bad weather comes, or maybe a snow day here in D.C., or some type of there's a power outage or something like that. You should always have several days worth of food and maybe water on hand. But what's going to happen here in the United States if there's an outbreak? Would people would the shelves be would they be emptied of items that you talked about, bottled water and things like that? That remains to be seen. My guess is that's a possibility.
Our overarching theme at the National Press Club this year is why journalism matters, and here we are engaged in this scenario, and here you are at a news conference at the National Press Club in front of a number of journalists. Can you speak as a last comment about the role of journalists in this and what you might ask of them?
Sure. Thank you, Mike. Again, it's a pleasure to be with you all today, and I opened up saying the value of you in journalism. You're here to get the facts out to people, to try to give them solid information. It's my job to give you the best information I have, but I'm counting on you to get that information out to the public where they know what they should do, they know how they should handle things. I hope that you will print up today was, while there's not a vaccine or antivirals yet, here's some things you can do today to prepare for this. And here's the day-to-day stuff you can do, like washing your hands, covering your cough, staying home when you're sick, cleaning the surfaces at your house. Those public health measures prove very, very effective during outbreaks such as H1N1, Ebola, and other things, Mike and audience, that I really hope that you will print that. We're counting on you. Please, please, please ask us questions, because a lot of times I find in my market, like you have today, you've challenged me with some questions that I need to do some homework on. And so your questions help me better inform my public, et cetera. So please, please, please keep up the work you're doing and let people know that this is a situation out there, and find that balance between communicating the risk and also mitigating fear.
I'm going to put social distancing on hold for a moment while I reach under the podium to present you with our appreciation, a National Press Club coffee mug. I think we're all drinking a lot of coffee these days.
Well,
and,
thank you. Well,
wanna-
based on that, I'm going to shake your hand too. So thank you.
Thank you very much. Thank you for
Bob.
joining us today. Thank you, everybody.
Thank you. We're new, huh? Oh, I heard. You didn't ask a question yet. Oh, you're welcome. Sure. Right. Sure. So. So in our situation, so the way the funding would work